Rahul, can you make Dr. Ameya a co-host so he can share his screen?
Sir, it is done. You had been now.
Yeah.
Also, just an information, we are live on YouTube as well.
Yeah. Good evening, everyone. I'm going to present a case of the hormonal contraceptives and cerebral venous thrombosis risk, a systematic review and meta-analysis, under the guidance of Dr. Sanjay Kumar Tambesa, Professor and HOD of BJMC in SGH Pune. The objectives of this case are that the use of oral contraceptive pills increases the risk of cerebral venous sinus thrombosis. The method was used was a study was performed to identify all the published studies on the association between the hormonal contraceptive use and risk of CVST in women aged 15 to 50 years of age. The results were the odds of developing the CVST in women aged 15 to 50 years taking OCP.
Slides are not moving.
Compared to
the slides are not moving and it's not on the slide show.
Yeah.
Okay. Is the slide moving right now, sir?
No. Make it a PowerPoint mode also, please.
Yes, PowerPoint. Okay. Yeah, it's PowerPoint mode right now.
No, not here for us.
You need to go to slide share, Dr. Amir, so that a full screen we can see.
Yeah, I'm in the slide share. Now you will be sharing to slide share.
I think it's the same problem. Just stop going to normal mode.
I will do it, Ameya, from my side.
Okay, sir. Sir.
So maybe it may not be the same font because it's a PPT. Okay. Are the slides visible?
Yes, sir.
Yes, sir. Yes, sir. Yes, sir. Okay, next slide. Okay, the objective is was whether the use of OCPs increases the risk of CVST. Between the hormonal contraceptive use and risk of CVST in women 15 to 50 years of age. The odds of CVST aged 50 years of age taking OCPs was 7.5 times as compared to the women not taking the OCPs. Data was not available about the duration of use and other forms of hormonal contraceptives. The conclusion of the study was the oral contraceptive pills use increases the risk of developing CVST in women of reproductive age. Future studies are required to determine if duration and type of hormonal contraceptive modify this risk. Okay, next slide. The background of CVST is CVST is a form of stroke whereby the thrombosis occurs in the cerebral venous sinuses or the veins. The incidence of CVST is 3.5 cases per million per population per year. It represents about 0.5% to 1% of all the strokes. It affects the younger population. It's 3 times more common in women. So next. The risk factors, the medical condition that increases the likelihood of thrombus formation, such as the thrombophilias, neoplasms, inflammatory conditions, transient situations such as the pregnancy, postpartum period, surgery, trauma, dehydration, CNS infections, and medications such as oral contraceptive pills. The use of oral contraceptive pill has shown in multiple observational studies to increase the odds of CVST by 5 to 22-fold. The presence of an inherited thrombophilia, such as factor V lead-in or prothrombin gene mutation, increases the odds further. So next slide, please. The objective of this systematic review and meta-analysis is to update the knowledge in regards to the association of CVST and OCP use among the women aged 15 to 50 years. In addition, the review of literature done to determine if there was data on specific types of OCPs, duration of use, and other forms of hormonal contraceptives, such as transdermal patches, Depo-Provera injection, and intrauterine devices, and the risk of developing CVST. Next slide. The method search strategy. a systematic review and meta-analysis following a predetermined protocol in accordance with the meta-analysis of observational studies in epidemiological was done. All searches was carried out without any language restriction, using free text and medical subject headings. Searching was done using two themes. The first theme was related to the exposure. The second theme was related to the outcome. The first theme included the hormonal contraceptives, oral contraceptives or OC pills, birth control pill, ethinyl estradiol, desogestrel, levonorgestrel, Depo-Provera injection, Mirena IUD, Nova ring or hormonal patch. And the second theme, which related to the outcome, was consist of CVST, intracranial venous thrombosis, sinus thrombosis, dural venous thrombosis, or venous infarct. Next slide. The study selection. There was inclusion and exclusion criteria was selected. Inclusion criteria was limited to the women of reproductive age, specifically in 15 to 50 years of age. The exclusion criteria, the pregnant woman or postpartum woman, the surgical patients, patient hospitalized due to trauma, patients with prolonged immobilizations. The exposure was any form of a contraception, such as the oral contraceptive pills, patches, or injection. The outcome was CVST, objectively confirmed by imaging like CT scan, MRI, or angiography. As CVST is a rare outcome case control studies, were most commonly employed study designed to measure this association.